Good morning, professors and fellow students. Today our group, represented by Yuxiang, Sanchen, Zhenghan, Junxuan, Bingrong, and Changyan, is honored to present a story of resilience and reform. We are looking at the 118-kilometer Lifeline, a mission led by Dr. Chao to bridge a staggering healthcare gap in Taiwan's South Link region. And let's look at a map between the Taidong and Pingdong. There is a 118-kilometer stretch of road with absolutely zero hospitals. We call this a geographic injustice hiding in plain sight. To put this in perspective, while people in big cities enjoy a doctor-to-patient ratio of 1 to 300, residents here face a ratio of 1 to over 1,000. In this region, time isn't just money, it's life. Treatable emergency often become fatal simply because the golden hour for treatment is lost during the long hours of transit to a city hospital. Next, my teammate will introduce a man who decided to change his reality.
The sacrifice of a hometown hero. In 2002, a young Taiwan doctor named Chao made a life-changing decision. He chose purpose over possibilities, leaving behind a high-paying, prestigious career in the city. He returned to his remote hometown of Dawu. He didn't just open a clinic, he became a solo emergency physician for the entire 180-kilometer corridors. Imagine working 24/7, seeing more than 18 patients every single day. Because he was a local, he provides something money couldn't buy: cultural credibility, allowing him to connect with ingredients patients in a way no outsider ever could. But the burden of being a super doctor comes as a terrible cost. In 2006, after 4 years of non-stop service, Dr. Su suffered a massive stroke at the age of only 39. It left a left side of his body permanently paralyzed. Most people would have retired, but Dr. Su was back in his clinic after just 6 months of rehabilitation. He famously started, "I still have one good hand and 2 legs to reach my patients." His own disability didn't stop him. It only deepened his empathy for those he served.
Dr. Xu eventually learned an important lesson. One hero is never enough to fix a broken system. To make sure care would continue long after him, he started the South Link Medical Foundation. This changed their work from short-term pop-up clinics to a solid, long-lasting medical system. By using his 2 languages and local roots, he successfully connected modern medicine with the trust of the local people. The results of this big change are truly amazing. For the first time in many years, over 10,000 residents finally have access to a local doctor. The foundation gives emergency care and keeps patients stable 24 hours a day. This means people are treated safely near home before taking a long ride to city hospitals, which helps saving lots of lives. They have changed the whole area from just treating late emergencies to active taking care of daily health.
The South Link model is more than just a local project. It is a living example of sustainable development goal 3. Good health and well-being is directly addresses universal health coverage by ensuring no community is left behind due to its location. By effectively managing non-communicable diseases like diabetes and hypertension, which are prevented in rural areas. The project is narrowing the measurable disparity in life expectancy between urban and rural Taiwan. This mission resonated with the entire nation through grassroots fundraising. Thousands of ordinary citizens across Taiwan sent in small donations. They weren't just giving money, they were voting for the belief that no one should be left behind. Media coverage turned a regional crisis into a national conversation about healthcare equity. This public support proved that when police falls short, civil society has the power to drive meaningful reform.
However, we must be honest. The mission is still unfinished. We face significant structural barriers every day. There is a staffing crisis because it is incredibly difficult to recruit young physicians to move to remote areas. Furthermore, providing 24-hour service in low population regions naturally leads to a financial deficit. As the population ages, the medical demand rises while the local tax base shrinks, making system solution from the government more urgent than ever. So, what can we do? You don't need a medical degree to help close this gap. You can be an advocate by sharing the SalesLink story on social media to break the city-centric bubble. You can support the local economy by purchasing agricultural products from the SalesLink region. You can even volunteer for summer programs or fundraising campaigns. We even challenge you to try performing your daily tasks with only one hand for a day, a small act that builds a genuine understanding of Dr. Xu's daily resilience.
To conclude, Dr. Xu's conviction has become a blueprint for the world. He proved that a single dedicated individual can spark a movement and reshape a system that everyone else thought was impossible to fix. The 100-kilometer Lifeline is no longer a symbol of neglect. It is now a corridor of hope. His model of combining community trust with cultural competence is now a replaceable blueprint for medical deserts everywhere. We execute today to support the SouthLink Medical Foundation. Stand with us for the principle that geographic should never ever determine destiny. As Dr. Xu says, medical care is not a gift. It is a basic human dignity. Thank you for today's attention.